patients that you diagnose today might not be here tomorrow when you come back for your shift, or, all of it. I don't know. I'm just tired. So it's almost 10 o'clock at night, and on my way home I got a FaceTime from my youngest child, who's 4, who's still awake. She really was upset because she didn't want to go to bed without seeing me. Kind of was hoping that she would be asleep because I'm tired and I just want to just relax a little bit and go to sleep because it's going to be an early day tomorrow with homeschool. And I think that's the hardest part. I think that's like just being alone when I come home, knowing that, my child care is going to go home, my helpers are going home, and it's just me and whatever state my children are in. And I don't really have a lot left in me, so I struggle with that because I wonder how much my children suffer from me kind of giving everything at work and coming home to it. Tomorrow's going to be tough because I am going to homeschool all day and I work overnight. I hope I can get a nap in at some point, but like I said, it's just me, so it really depends. It's been a long day. Probably got a couple more minutes in me, and we'll start again tomorrow.
That's Dr. Melanie Malloy. Even as she points out that things are better this week at Mount Sinai, Brooklyn, where she works, than they were last week. This week is better because they're only completely full, as opposed to being at 200% capacity in their ICU like they were last week. You see her there; she's still sort of, working past the point of human endurance right now. New York City revised its count of the dead today to account for people whose deaths were attributed to COVID-19 causes, even if they were never lab tested for the disease, which seems like a pretty sensible recalibration of that data. I think most sharp observers had realized that New York was probably undercounting its dead. The refiguring that the city did today pushed the New York City death toll alone to more than 10,000. And that pushed the American death toll overall to more than 29,000 dead. Here's Dr. Dean Babich at Long Island Community Hospital.
So Corona or COVID-19, I think, really took us by surprise. We weren't properly prepared, and not because of a lack of equipment, lack of PPE, or a lack of ventilators, just by the daily onslaught of patients flowing into the emergency room day after day, hour after hour. It's a mass casualty incident that just won't stop. And these patients are quite sick, many of them requiring ventilators, many of them requiring intensive care treatments, and many of them not making it. In fact, earlier this week we lost one of our own, a truly dedicated and wonderful critical care nurse that succumbed to the virus in the same unit where he, for the better part of 15 years, took care of our patients. We're throwing everything at this disease process, from antimalarials to interleukin inhibitors and convalescent plasma. And yet, it's simple. The way to kill this virus is simply just stay home. Stay home and wash your hands. And if I can give any kind of advice to anyone, it would be just that. Leave the healthcare workers to take care of our patients and help us just stay home.
Help us, just stay home. Governors in the remaining U.S. states that are telling their residents not to stay home are flying in the face of this advice from the American healthcare workers who have faced this full on first. And maybe it's because New York got hit first, and no other places in America think of themselves as being anything like New York. But New York did go first, and they really are trying to tell the rest of it. And so I don't know if Heartland governors who are still resisting this advice find it easier to hear from a place like Indiana instead of New York, but here it is.